All right. We will go ahead and get started. Welcome. This is another Arizona Women Leading Government webinar. My name is Andrea Alicote. I am with the City of Mesa, and I am proud to be a board member for Arizona Women Leading Government. We try to bring these different webinar series to touch on really important topics that face us here in the workplace. And this month, we chose to highlight Mental Health Awareness Month. We were happy to kick it off on May 1st with our first webinar series, which was, or session, I should say, Going Beyond Stress Management, where we heard from Andrea Sarai, who we have here again with us from Oro Valley. We were really talking and touching about mental health as it is from an individual level, from a topic level, and how we are able to integrate different tools, whether in the workplace or even personally at home. And so that was really a foundational episode. I'll go ahead and put it in the chat so that way if you missed that session, you're able to go back and rewatch it. But today we are going to be talking about different innovative programs from 3 different agencies. Again, it'll be Town of Oro Valley, the City of Mesa, and the City of Tucson that we'll hear from. These sessions are really going to be talking about 3 innovative ways these municipalities have been able to integrate mental health and behavioral health programs for employees. And we hope that you really learned something today to be able to take back to your own municipalities. So even if you are, whether you're an administrator or supervisor or just here as an individual, we hope that you learned something from these different programs. So that way then we can learn how to kind of destigmatize mental health and making sure that as employees in our own agencies, we're able to bring more awareness to this topic and how you can maybe learn from each of these 3 different agencies, different tips and tricks that we can, again, reflect in our own workplace. So without further ado, we're going to go ahead and get started. And again, we have an Amanda and Dale here from the City of Mesa. I'll have them give a wave. Hi, both. And then we have Art and Linda here from the City of Tucson. We'll have them give a wave and a hello. And we will be going ahead and hearing from them very soon, but I am so happy and honored to be able to turn over the time right now to Andreas Roy from the Town of Oro Valley, and we'll be able to hear what type of program they have up first for us. Andrea.
Awesome. Thank you so much. I'm so excited to be here again. So thank you all for joining. My name is Andrea Sarai. I'm the executive assistant to the mayor, town council, and town manager over at Oro Valley. Today I'll be talking about our approach at Oro Valley for talking about mental health and bringing it to the workplace. And a little bit about me. I'm a peer. I have bipolar 2 and OCD. I'm a mental health first aid instructor, a board member for Beautiful Purpose, a bipolar community. I'm a peer support group facilitator, trainer, and program manager. And so I like to bring my passion to the workplace, and I'm excited that I'm able to do that. So let me get to that next slide. So just a quick summary of what we went over May 1st. We talked about the difference between wellness and well-being. Wellness being that active process, which requires awareness and action and has a very prominent physical dimension. There's 8 categories of wellness. We discussed well-being and the as an overall perception of positive welfare can be static, but it has a really prominent mental and emotional dimension. And there's 5 elements of well-being. Overlooking well-being in the workplace can have an impact on employees' overall health, rates of workers' compensation claims, interest that the workers may have for working for other employers, and then odds for them actually changing positions. We went over some statistics. I'm not going to go over each one, but there was a question last time when it came to the stat of 1 in 20 adults experience serious mental health issues each year. Serious mental illness is a designation for chronic and long-term mental health conditions that impact a person's ability to perform day-to-day activities. It's a smaller and more severe subset of mental illnesses, which can include major depression, bipolar, schizophrenia, OCD, panic disorder, post-traumatic stress disorder, borderline personality disorders. So when we're talking about 1 in 20, that's the context. We also discussed some lived experiences, mental health in terms of government policies, like driving examples, conservatorships, what changes we may see to Medicare. I don't want to go too deep because there's a whole webinar dedicated to all of that. But how we decided to bring it to the workplace for the town of Oro Valley is through the mental health first aid program. It's actually overseen by the National Council for Mental Well-being. Mental health first aid actually started in Australia in 2000, and then it was brought to the US in 2008. It's now been adapted in over 25 countries across the globe. It's evidence-based international program, and so there's a lot of research that goes into it in the book itself that learners get. There's over 300 different citations when it comes to just the knowledge they're providing. The World Organization recommends protecting and promoting mental health in the workplace, and they suggest it in terms of really focusing on supervisors. And what that looks like is training managers for mental health. So supervisors know how to recognize and respond to emotional distress, really building that interpersonal skills, opening communication, active listening. They also suggest training workers in general for mental health literacy and awareness, which helps reduce stigma, and then interventions for individuals. So really skill building and providing resources so individuals are empowered to be able to manage their mental health. And so mental health first aid, just kind of a brief what it is it's kind of like the idea of assessing like a lifeguard. A lifeguard is kind of making sure people are swimming fine, looking out for those that may be struggling to get to the wall, or maybe there's some struggling and needing support and assistance. And then of course, if someone's drowning, helping them get immediate intervention. And so mental health first aid is really that practical approach on signs and symptoms of mental health and substance use disorders, how to interact with a person in crisis and non-crisis situations, and how to connect people with help. I did mention last time, one of the statistics is even when people finally seek help, a delay of more than 10 years is not unusual. And so that can cause really serious consequence, increased risk for depression, drug or alcohol disorders. And so this program really helps get resources to individuals that need it and close that gap in getting people help. And so within Oro Valley, how I see the program goals is just continuing to enhance our culture of inclusivity by embracing mental well-being and providing that knowledge and resource, empowering our fellow employees by letting them know, how to talk safely about mental health, actionable approaches if they notice someone struggling, ensuring safe places, and then overall reducing stigmas by providing those statistics, information, and non-stigmatizing language. So how I came about doing this, I had learned about mental health first aid right after I first got diagnosed. And it was so empowering. When you first get diagnosed, it doesn't mean that the information just shows up. And so for me, it was really deep diving and learning more about mental health. So I had been wanting to become a mental health instructor for quite a few years. But then I wondered why I didn't bring it to the workplace. So I pitched it to the town manager's office and HR and gave them those reasons why and recommendations. And there's kind of two ways that you could bring mental health first aid to the workplace. Anyone can go to the mental health first aid website and sign up for a course. The prices can vary. The mental health first aid organization values these classes about $170 per person, but the instructors set the rate. So it could fluctuate in how much that costs for employees. What we decided to do is start a program, and kind of a timeline of what that looked like is in spring 2023 is when I brought it to the town manager and HR. We made sure we had the budget for it, and I'll talk about pricing later. In July, I became a certified mental health first aid instructor. I'll explain what that process is in a bit. Then I spent a lot of time planning the rollout, communication, getting that support from town manager, HR leadership. really practice the content because it is an 8-hour training. So it takes a little bit of time to get confident and familiar with all of that. In March, I did a soft launch for mental health first aid. And so I got a group of volunteers who were willing to let me stumble and try out leading that first session. This May is when we're launching it to executive leadership team and senior management team. So I actually trained some of our supervisors Monday and yesterday. And so some of our first batch of leaders just got certified. And then this July, we're launching it out townwide. So anyone interested can take it, whether it's, to build that leadership skill or just learn more about mental health. So the program itself, kind of the cost breakdown, is we have one instructor for the town. I became certified instructor. It is not my job or position. It's just a project program that I'm taking on. And so I used our tuition assistance program in order to get certified. It was around $2,400-ish, give or take, to sign up for the courses, get all the supplies for it. And then I have a instructor shirt and instructor badge, which was $85. And then ongoing prices is the in-person training sessions. There are different options where I could do a hybrid class where it's virtual and then a live training, but we decided to do it all in person. So, the costs look like basic office supplies, about $30 for each person that gets paid directly to Mental Health First Aid organization for course and book materials. And then I spend about $20 a person for 2 meals since they're there for 8 hours, a breakfast and lunch typically, or 2 breakfasts if I split it up over multiple days. And then to become an instructor, some of the training requirements, you must be trained as a mental health first aider first. It's an 8-hour course, a lot of different options in ways to get trained. You submit an application and get approved. There's 2 hours of self-paced pre-work. It's a 3-day training that's virtual, and then that live interactive portion. You do have to practice presenting some of the content to the instructors of that instructor course, and then they grade you based on it. A 1-hour self-paced post work, a written exam, and then once you have the certification, it's actually really great because my certification, as long as I teach 3 courses a year, never expires. So I don't have to repay that $2,400, however much that was. It's just those class costs, as long as I'm maintaining my certificate by teaching 3 courses a year. So, for us, it just made sense, that one time $2,400 cost. And then, like any training, most trainings cost the town some amount of money in terms of the training, and $50 we felt was a good investment for this training. So this is the soft launch. We have people representing from our town manager's office, IT, Parks and Rec, HR, police departments. And then yesterday, this week, we have planning, our community and economic development, public works, more IT staff. And then in the next trainings, it includes more of our town manager's office, more of our community and economic development, legal and water staff. So we're very quickly, so far, by the end of the month, we'll have 9 out of 12 departments. So we'll have at least 1 individual, and most are supervisors that will be trained on mental health first aid. So I'm super excited, especially formalizing it and just providing the resources and being able to know that people have multiple people to go to in their own departments as well as townwide, and just creating that safe place to have those conversations. And that's what I have for today. I'm happy to take questions. I believe we're doing it at the end.
Yes, thank you so much, Andrea. And please, if you all have questions about this program or any of the others that we're going to be hearing about, please put them in the chat or use the Q&A feature. Those will come directly to myself, and we will be saving some time to have a dialogue with all of the practitioners. So I really love to hear about what the town of Oro Valley was doing. I think that it's such a great first step, particularly if your town or municipality does not have the staff dedication or ability to do a large scale program. Simply as an individual, knowing that there are really robust certifications and trainings out there that maybe you can use your own tuition reimbursement process or some other tools to at least as an individual be able to upskill and then share that knowledge within your agency. Wonderful, wonderful work. And we look forward to hearing from you again soon, Andrea, as we get closer to the second half of our webinar here. And up next, really happy to introduce and turn the time over to my colleagues, and very proud, humbled, and honored to be able to say that this is a program that's available to myself as an employee of the City of Mesa. Amanda and Dale, the time is getting turned over to you now to share what we are doing at the City of Mesa.
Thanks, Andrea. My name is Dale. I've been with the City of Mesa. I work for the fire department and the city, and I've been with the city 30 years and help run the new peer support program.
Hi, everyone. My name is Amanda Freeman. I'm a special projects administrator, and I've been with the City of Mesa for a decade.
I just have to say, I love what Oro Valley is doing right now. It's fantastic.
Yeah.
Kudos. So a little quick history on what peer support is and why it got started. Peer support comes from really that first responder sort of the world, right? We deal with things in crisis, and that ability to communicate at a peer level and provide first aid, if you will, or that resource. It then grew from something from there where we realized that there are more needs out there within the city, more needs out there within the firefighters, police officers, first responders, doctors, nurses. So what we've developed is something that's more comprehensive, that deals not only with crisis and emergencies, but it deals with everyday life. It deals with family and the employee. Why did we get started in doing this? We got started in doing this because we were asked to. We were asked to by the city. We have been doing this for the police and fire departments for so many years, but the city council really stepped up just prior to COVID and recognized the work that was being doing on other departments and across the valley, said we need more. And then when COVID really hit and we saw the stress that was on the workforce, council and city management stepped up and said, we really want to implement a program that's for all city employees, not just for those who are first responders. And that's really where this launched from.
So one of the things, one of the notes sort of in the agenda of the meeting today was like, how is this something that can be implemented at potentially a lower cost? And I feel like our peer is a perfect example of that, in that we sort of got started with a couple people who both have full-time jobs who got assigned to this, and we created this QR code that you see here. And it was just a gathering of the resources we already have available to our employees that we put in one place so that it was easier for them to use those resources. So you can imagine on our city website, if you go to the benefits page, you can see all the different places that we have all these different benefits. And we, as a city of Mesa, we really have some amazing benefits. But it was hard to use. It was hard to know, where to find them, or how to get a provider, or just sort of trying to figure out the logistics of it. So what we did is we created this QR code, and we have it on business cards, and we also have little stickers that we're sort of handing out to everyone that we go out to. And someone can scan this QR code. If you'd like, you could scan it right now, and you could see what this brings you to. And it'll bring you to a page that we created that just has the mental health resources that are available to our employees. And what we're doing is we're going around to as many departments as we possibly can and doing presentations just to tell people, like, hey, here's this QR code, here's what's available to you. It's available to their families as well. But to just let people know that the purpose of peer, it's not that we are the counselors, we're not the people that they're talking to, but we're going to help them take advantage of the resources that they already have available to them. So next, I'm just going to go through really quickly some of what is on the website, because these are all our benefits and you guys don't really care about that, but I want to show you kind of what's on the website. So we just have an example of what our insurance is, and the kind of benefits that you get out of our insurance, and then the information to find that. And then we of course also have EAP And this is the one that I really wanted to come to, in that this is, so 988 and Solari. Solari is the crisis hub, basically, so the call center, if you will, for the entire state of Arizona. So I'm assuming everyone on this call lives and works in the state of Arizona, which means this slide applies to you. And what I love about it is that this is, of course, as you can see, not a resource that the city of Mesa has for employees, but it's the state of Arizona. So we really took as many resources as we could find that were available and put them in one place. And then the next one is just that we have our employee health and wellness center. So again, just a website to describe to our employees, here are all the benefits that you have available to you related to mental health. And if you're having trouble, if you call us, then we can help walk you through that and figure it out to know, which ones to use and how to get a provider. And just sort of, if you need someone to hold your hand, we can do that too.
What we realized in that first responder world is that if we don't have the ability to pin a note to their shirt and send it home with them like a kindergartner, that a lot of this information doesn't translate. And lo and behold, it's the same for all city employees. So we really wanted an access point that you could get to from anywhere. It didn't block you, you didn't need to log in, but we wanted to make sure that everybody understood what our benefits are. What we have found in the fire department is that 50% of the people that we provide resources for are spouses and family members. And we know that that's a big part of coming to work every day, is making sure that your family feels comfortable and your family issues are being helped, and those issues have resources. So we really wanted to make that happen. And that's what kind of started this process for us. And then we started talking about some of the things that we want to do for the future, right? We talk about educating our new employees. Amanda and I have now been invited to that new employee program. So every new employee coming into the city, hopefully, will go through some sort of presentation about what the resources are. We do this now for police and fire and dispatchers. Our goal is to make that citywide, so that your first day on the job, you understand what's available to you, and it's not just a flyer that came in your new hire packet. And then really being more proactive, right? Engaging with those employees on who and what needs to be done, right? So part of our mission now is that we're finding ourselves in the leadership program. Matter of fact, after this today, we're talking about, or we're presenting at our leadership program, which is going to be fantastic. We've gone out and we have taught now, Amanda, 14 classes, 15 classes.
A lot, yeah.
Including the city of Mesa, which is a pretty large city, very much similar to Tucson. We have 450 summer employees that come in that are either part-time or either part-time or seasonal employees, but making sure that those employees also have the information about what benefits are out there.
So one of the things that we wanted to make sure of is that our leadership and our supervisors, so the way we're breaking this up is Dale and I, last year, I think in September, we presented to our executive leadership on what our benefits were. And most of the people in that room did not even realize how good our benefits were. And so again, it's just, if you have this really good benefit, it's not doing you any good if you're not using it. So the whole idea behind this was, how can we get people to use these benefits if they need them? But then also using peer as a tool for our supervisors. So, the supervisor could be in a position where their employee maybe is getting in trouble, but they're getting in trouble because their performance, isn't good at work. But there's also something bad, maybe that's happening at home or something that's happening in their life. And so sort of, how do you balance that, being a supervisor, but also being a nice human? And so the way that we're trying to advertise that is, well, let us do the human side of it and you do the supervisor side of it. Like, you still do the things you need to do, but hand them a peer card and say, if you need help or if you need resources or if something is going on, reach out to peer and they can sort of help walk you through, all the benefits that are available to you. I'd like to add, I don't think Dale would ever say this, but I think having a first responder as someone who is on the peer team makes a big difference. And I think it makes a big difference when it comes to breaking the stigma, because I think the firefighters and the police officers are oftentimes seen as the, as the heroes in the world, if you will. And it's like, they're the ones who've experienced all these traumatizing things, and, it couldn't possibly be anybody else, when in fact we all know that that's not true, and that trauma or crisis is relative, and that all of us are experiencing our own things. But I love having a firefighter who's coming out to our departments and saying, hey, like, you should get the help you need. If you're experiencing something, here's how we help our firefighters. Our firefighters are going through the same thing, and here's the kind of help that they get. And so I think I think that's part of breaking the stigma, is having someone. I think it's helpful to have someone in that role who is out there speaking about the benefits and how to get the help that you need. Is there anything you wanted to add, Dale?
Yeah, to your point, I think Amanda nailed that with the breaking of the stigma and what Oro Valley is doing and what we're doing by getting out and educating in front of your groups of employees. You would be amazed at how quickly it does break that stigma. There has not been a single class that Amanda and I both have taught where somebody has not raised their hand with personal issues or experience, and they're willing to share it in a room full of peers, people that they work with every day. And in some cases, people that had no idea that this was going on in their personal life. So by being proactive and by being out in your community, your city and your department's community, you would be amazed at how quickly that stigma is broken and how many people want the resources that are being provided, which that for us has been amazing.
So thank you for listening to us, and we look forward to answering any questions at the end of the webinar. I'll stop sharing right now.
Thank you.
Thank you so much, Dale and Amanda. I think this was, again, so proud and honored to be part of the city that has put stock and effort into being able to support the work that Amanda and Dale have done. I'm proud to say that, you know, again, the stickers that they mentioned are on the back of my own employee badge card here. So that way then, should we ever need to be able to call upon those resources, we have those ready available. And you know, information is power, knowledge is power. And so again, a lot of this is maybe just gathering the resources and the benefits that you have in your own community and making them more easily accessible and talked about and shared throughout your community, whether that is your own small team, your department, or your city or community at large. That's how we are really truly going to start being able to make headway into bringing mental health awareness. And so last but not least, we have the city of Tucson for their behavioral health services program. I am so happy to turn over the time over now to Linda and Art. And once again, please use the chat or Q&A feature to be able to put any questions that we will ask in the follow-up shortly. Linda, go ahead.
Thank you, Andrea. My name is Linda Kyle. I am the benefits administrator for the city of Tucson, and I have been with the city since January. I'm happy to be here and taking on the benefits administrator role. I'm going to go ahead and let Art introduce himself. A little bit different, but he was in this position before me.
Thanks, Linda. Good morning, good afternoon, everybody. As Linda said, my name is Art Guado, and I am the Treasury and Pension Administrator for the city. And some of you may be wondering, how does Treasury and Pension fit in with benefits? The nexus is I was the Pension and Benefits Administrator until January when Linda arrived. And so the program that we're here to talk about today was really under my purview at the time when we launched it. And so, you know, that's how I'm involved, and that's why I'm here. This is a really couple tough acts to follow from Oro Valley and Mesa. So really appreciate the time today. Our program that we're going to talk about, and Linda and I will sort of tag team the presentation, is centered around behavioral health counselors that the city hired back in 2020. And when we talk about behavioral health providers, we're really talking about counselors that work technically on site for the city of Tucson. And this wouldn't really be possible without a partnership from and with Cigna. The city was out for an RFP back in the 1920 fiscal year. And as part of that RFP, you know, it was awarded to Cigna, and in their method of approach, they proposed this really unique idea about on-site behavioral health counseling. And our executive leadership at the time thought that was a really interesting idea to bring forward to the city of Tucson and our employees. And I should also take a little bit of time here to note that the city predating this program all and have today dedicated counselors for our public safety. So one each in TPD and our fire department. But we recognize that there was a contingent of employees that were maybe missing out on behavioral health counseling. And so through the effort between the RFP and Cigna, we were able to launch this program in December of 2021. We have two dedicated behavioral health providers that are available to city employees at no cost. There are no limits to the sessions that are provided. We are only currently offering virtual, and I do know that there is a plan to have on-site visits and on-site sessions with Tanya and Lauren in the very near future. We originally started with one and Tanya, and that was like, again, Tanya started with us in February of 2021. And as the program got rolling, and we'll talk about some statistics here in the next slide, but as the program really got rolling, and we endeavored to take it on site, we wanted and recognized the need to add a second counselor for added flexibility for weekends, for nights, for our employees that work shifts. Not everybody, as we all know in our municipalities, don't work a regular 8 or 9 to 5. We often have guys that come in early, women that come in late, or working various shifts. So we added Tanya. I can't remember the exact date that was added, but we did add that second counselor to add evenings, early mornings, and we're offering weekend shifts. And again, we do plan future services to include in-person sessions and spouses. So a couple of unique features. As I mentioned, this is no cost to the employees, but it is for employees only. Our retirees are not able to take advantage of this, neither are spouses. So that is one of the enhancements that we have planned, that Linda and her team have planned in the future, is to open it up for spouses. You don't have to be enrolled in our health plan. So these services are offered over and above our standard EAP counseling for 6 sessions, as well as all of our other EAP services that Linda will talk about here in a little while. So this is a true enhancement to those services. And so we recognize that need. Linda, I'll pause here. Anything else you want to add before we go on?
I think you covered pretty much everything I was going to include. Again, very excited that future, we will have actually a brick and mortar location for our counselors that will be open up to employees and spouses.
Before I leave the slide, so talking a little bit about some of the topics that are covered from Tanya and Lauren, we have work-life balance, there's relationships and intimacy, there's substance alcohol abuse disorders, anger management, depression, anxiety, parenting skills, mediation tactics. Those are all topics that list isn't exhaustive, but those are all topics that an employee can come in and make an appointment to see a virtual session with either Tanya or Lauren. A couple of other things I want to mention is when they're not taking appointments during the week or weekend, they do offer team trainings. I know Linda and her team are getting ready to roll out lunch and learns for the program. So there'll be a topic per month, and everybody can bring their lunch, and Tanya and Lauren will give sort of an hour training. And then they also respond to critical incidents within the city. So this may be, where we have an employee who may have passed away in a department and they need grief counseling. Tanya and Lauren are available to service that particular department and anyone who may need it. That may have known the employee. And just sort of anecdotally, I want to provide a story that happened pretty early on within the program that I'm super proud of. We had an employee who was facing a critical incident at the time. I believe the employee was considering or contemplating suicide. They called the number that's listed on our website for Tanya and Lauren. And despite the fact that, Tanya and Lauren don't respond to critical incidents, we have a dedicated number for that. Tanya and Lauren were able to talk to the employee and connect them to the care that they needed at that time. And the employee ultimately not only survived the incident, but also rebounded and came back stronger as a result of the program. And so for me, saving that one employee's life was completely worth the program, and setting up the program and going over the program and going through the mechanics of setting it up with Cigna and the launch and the logistics of it with Cigna and the Evernorth team and onboarding, that entire episode is what I feel is the benefit for the program to our employees. So just wanted to share that personal story. And I know Dale talked about the destigmatization of mental health, and we were very intentional in calling the program behavioral health and not necessarily mental health for that exact reason. So I do think it's critically important. How we message the mental health component and the behavioral health component is as important as the program itself getting over that destigmatization. So we'll move on to the next slide here, and just Linda will talk about sort of our utilization counts from the inception of the program to today.
Thank you so much, Art. And then one other thing too, that has really helped our employees is the fact that because they are our two counselors that are available, they can build the relationships with our employees, which makes a big difference instead of having to call EAP, even though EAP is available to us. Just knowing that I can go to Tanya or Lauren. I've seen them before, and so you just have the ability to continue that relationship. So as you can see here on our table, the utilization counts, again, we started in December of 2021, 19 visits, 11 unique patients, but as you see, we progress per quarter, how the numbers have increased. So in our first year, we had 772 visits with 75 unique patients. Fast forward to 2023, in the first quarter of 2024, increased our visits to 1131, and with the unique patients up to 124. So that was almost, doubled on those unique patients. And so again, this right here says it all on, I tell the story of, how successful Tanya and Lauren being here have really helped our employees. So again, wanted to share additional behavioral health services that we do provide to our employees. Again, this is through Cigna, but just more tools and resources that we have available. Of course, our employee assistance program, which is separate 6 face-to-face visits, and you can continue. You've got access to different types of services, referrals, discounts on child, pet, elder care type of services, legal services, financial services. But more importantly, as we get into the other ones that are listed here, these are, again, just tools and resources that help our employees to be able to deal with situations that maybe they're not ready to see a counselor, but you do have access to these resources. So again, just a few of them listed here, and then we've got some more on that second page. But it's just really definitely at least the start for someone to say, hey, I feel comfortable doing this. What's the next step? And they can reach out and request some additional service. So thank you very much for allowing us to present, Andrea, and we're here to answer any questions.
Thank you so much, Art and Linda. It really, what you had mentioned in terms of some of the topics that you had listed that your providers speak to, I think those are all topics that felt so relevant to the things that we discuss within our various groups, such as Arizona Women Leading Government through our conference sessions. So that really kind of hit me close to home, that when we're talking about mental health awareness, I like how you explained, Art, the term behavioral health to make that a little bit more friendly and destigmatizing. The theme from all of these presentations really leaned heavily into making this part of your daily communication within the workplace. I think that is any type of common thread, the secret sauce that I have heard today from all of these presenters is really that we need to make this conversational. We need to be able to empower employees and staff and supervisors with the tools to make it a friendly conversation in working with employees. And then the follow-up of, we all have resources that are available, whether it's statewide, as Amanda and Linda had just shared with us, or if it's going to be your own internal employee benefits. One thing that we did not touch on heavily is the EAP resources that almost every municipality has within their healthcare benefits. And really that was intentional in trying to look at innovative programs that go beyond EAP. But that is such a significant resource that I think we do need to acknowledge. So again, please use the chat and Q&A feature. We're going to jump into our little fireside chat now. I've compiled a list of some of the submitted questions. So Andrea, I'm going to pass it off to Oro Valley first. We did have the question come in on specifically with your program. Who provides the instructor training, and is there, can you give us more information on where we're able to access that?
Yeah, that is so great. I don't know how I missed including it in the slideshow, so I really appreciate that information. So it's available at www.mentalhealthfirstaid.org /become-in-instructor. So it's through Mental Health First Aid organization itself. And so there's actually a tab when you go to that website, and they go through all the steps and next steps for individuals.
Great, thank you. And we did go ahead and put that link into the chat for you all. So again, if you're looking for that certification or training programs. Andrea, I also wanted to see if you can share a little bit your personal thoughts, your agency. Do you think that there are local government policies that could have some mental health implications? Is there ways that you have seen how policies, whether it's internal management policies, whether it's more institutional ordinances and foundational policies, do you think that there are some that now that mental health is become a more prevalent topic that have adverse effects?
So I feel it's a great question. And so I spoke a lot on the last webinar about some of the unintentionally adverse effects that some government policies can have with individuals experiencing lived experiences. I know one of the hardest things I feel is before there was a push when it came to police departments. I really want to acknowledge all the work that police departments have done. I feel like they're some of the most progressive agencies in terms of mental health. But if we're looking at like decades back, before mental health was even a topic, it's very hard for first responders to respond to all situations, and especially when there weren't policies in place and there wasn't knowledge on mental health. And it's not adverse reaction, but it's actually a shout out in terms of one of the things that I see that helps internally and externally are the mental health crisis units. It's really great because if someone's needing help, they can call 911, let them know it's a mental health crisis. A lot of the police departments are trained to bring individuals in casual clothes to de-escalate the situation. And so that's where, whereas it could have been a negative experience for people with lived experiences in the past, we've seen this shift where, first responders are prioritizing, are focused, are training. And so I think we're constantly, even the programs we see today, with all the speakers that may or may not be first responders, we're seeing this push, and it's great to see. And those directly make it a more positive experience in the workplace and in our communities.
Thank you. I think that is, a great point that you made. And I'm sure Dale is also in agreement in terms of just, when we're talking about, again, this webinar was really focused on what we're doing to support employees, because I think it is something that, again, a lot of agencies are looking at and having to tackle from a completely different lens of how we're providing that to our community. But, the topic of being able to bring that awareness, make it comfortable. Dale and Amanda, my question for you was really going to be that your program focuses on that anonymity and confidentiality factor, which makes it available for folks to then reach out to and makes it easier. So very much in parallel with what Andrea was just stating. why do you think that is so important? And if you even want to touch on her previous comments, please feel free to do so.
Absolutely. I think both, and I have to agree with everything that Andrea said from Morro Valley. The idea of putting yourself out there and letting this information be known, that helps break down that stigma to begin with. But there always is that sense of concern of who knows and how much do I want to share. So one of the things that we do here in Mesa for our peer team is the first thing we do is we get ourselves trained. And through that training, there are support through state legislation that provides confidentiality that can't be broken unless somebody is a harm to themselves or others. So we start there, and then we sign a confidentiality agreement, and we let the individuals know that are reaching out that that's our standard, right? First thing we ask them, how do they want to communicate to us? Does it want to be via text, via phone, email, city email, personal email? What makes them most comfortable with the confidentiality piece? So that's our beginning stages of what that looks like, because I think that's that warm blanket to soothe that fear of reaching out for the first time for help. So I think we have to have that. But then ultimately, the goal is to have that change so that people feel comfortable reaching out and talking, so that it's not just talking about it behind closed doors, but it's talking about it at the water cooler, right? That people feel comfortable saying, hey, you know what? I heard you were talking about an issue you're having. I have a great counselor, or I have a great resource, or I know somebody, versus it having to be something that's more taboo. And going back to Andrea from Oro Valley, putting it right out there and who she is on her presentation, that is amazing. And I think that really helps the idea of where this should land down the road. So we want to make sure that people feel comfortable with confidentiality, and the work that we do with them is personal and private, but we hope that someday people can talk about it openly and share it wherever they feel most comfortable.
Awesome. Thank you, Dale. And we did have an additional question that if you're able to share with us the link for that AZ statute, you can either put it in the chat or we can follow up at a later time. But that was really information that I think our participants here latched onto. And this is exactly why we're providing this information here today, because I think, talking about mental health, behavioral health, we feel if we're not familiar with it, it's a taboo subject. A lot of times supervisors are maybe scared to ask those follow-up questions and how we can relay resources, because, there really is this personal and professional line that it's so much more of a gray area. And that kind of leads me then into my next question, Art, Linda, whoever wants to take it. But, mental health can compound over time. I think it was Andrea who had mentioned early on that it can take up to 10 years for somebody to maybe feel comfortable in seeking help and finally being at the point to even start the process. What I felt that your approach was really that integrated approach where you are looking at an employee's health and well-being with those topics that you were talking about that your counselors provide assistance with. Can you speak to a little bit more on that dynamic between personal and professional wellness in the workplace?
I'm happy to take that on. So I think with our integrated approach, I think it really does help the fact that the different topics that are available through our counselors, Tanya and Lauren. But I think, again, as I mentioned earlier, the fact that we have two providers that are here available to our employees, it gives us the chance to build those relationships so that our employees feel comfortable sharing, whether it's professional or a personal situation that comes up. That just says a lot, knowing I've got that, I can build that relationship. I don't have to worry about, calling EAP. And again, no, I'm not, lessening the EAP services, but just the fact that we know that we've got a set, group, two people that are available to our employees really does help just cover that and give it a more personal approach and keeping it safe and feeling comfortable.
Awesome. Thank you, Linda. Andrea, back to you in Oro Valley. I wanted to, see how can supervisors and colleagues help to create a healthy work environment? So again, luckily, a lot of our participants are here to support, and from some of the agencies that are featured here today, but for anyone that is not part of Tucson, Oro Valley, or Mesa, we all can start at home with our little teams, and what can supervisors and colleagues do to support one another?
Well, I really appreciate people being here today. I think that's a big thing, showing interest and showing that you do want to prioritize mental health, or you do already and you want to see what else is out there. So thank you firstly for being here. But I think a big component is, listening, that human touch. A lot of the time when people are struggling, it's they want to be heard, they need to be heard. Taking those opportunities to train, just building more awareness. One of the things we teach in mental health first aid, that we know based on evidence, is people are more likely to get help if it's someone they know that's recommending it. And so, it's building those relationships, knowing those resources, being able to suggest, whether it's professional help or self-help tools, and just, showing that care and compassion. So I think just, starting at the base of bringing that human touch to it makes a huge difference, and then if there are opportunities to bring these programs, moving in that direction is always a great thing.
That is such a wonderful insight. And I think that is kind of the root of what we're talking about here today. The humanistic approach into, things that may be affecting us personally, bringing into the professional environment. We need to be able to treat it all individually, and with the concern of really being able to listen and identify when somebody may be not even asking outright for help, but that we need to be able to really understand that a lot of times we are multi-layered people, and that, this comes into the workplace. I think another facet to be able to recognize is that we are all public servants. And so the things that we deal with on a daily basis can be the things that are impacting us. So again, we touched upon that, whether it's public service or public safety professionals, but even those that are working, telephone calls, being able to have assistance programs. There's a lot of things that are coming at us just being in a field where we are providing aid to others. And so this is such an important conversation to have. Amanda, I just wanted to circle back to you one more time in being able to, what I loved and what I know obviously about the City of Mesa's program, the work that you did in building up some systems that are community facing, such as working with Solari and some of the other agency partners. That was a real big trigger for you to be able to then reflect that internally. So I just, as we're wrapping up here, wanted to be able to hear again, so that way we can hone in on that message of how you were able to take known resources and reflect those inward. And for you to be able to, again, once touch on some of those things that are available statewide.
Yeah, so I appreciate that. Thank you. So I happen to be the project manager for our 911 response to mental health calls. So I work a lot with the crisis system. And so that was why I was brought to be a part of the city peer team, was how can I take what I know about the crisis system and what's available to everyone and sort of apply it to our employees and our supervisors and everybody that's here. And so, that's part of what we've done. But the thing that I think is probably the most important is, like, as an example, the City of Mesa has some of the best benefits available. So right now in our insurance plan, you pay nothing for mental health help. So you pay no copay. There's nothing. The cost is 100% free. But if you go out to the website and you try to find a provider, even EAP, right? EAP has such good stuff in it, no matter who the company is that you use, but it's so hard to access it. So what is the point of the benefit if it's like hard to take advantage of the benefit? So that really is what we have been focused on, and that means that Dale and I are having meetings with the people at Cigna to say, hey, when we go onto your website and we click this button, it doesn't make sense. So can we change that? And if we can't change it, then how do we make sense of it so we can explain it to our employees? So really just, thinking about, just because you have these really awesome benefits may not mean that it's super useful if people can't access them. And I keep thinking of that every time I hear someone talk about EAP and how frustrating it can be, because EAP really has some good stuff, but you need someone to hold your hand and walk you through it. And that really can be as simple as you just have someone in the city who's the SME, who's the subject matter expert on here's how to work through these things. And it can just be that there's one person who's dealing with the companies to find out, like, how can we make this easier, or how do we do this right, and how can we make this easier on our employees?
That is a wonderful way to wrap up this conversation. Thank you so much, Amanda and Dale, Andrea, Linda, Art. We cannot thank you so much for all of this information. I do also want to just put a plug. Dale did some quick finger Googling and searching and got those AZ statutes for you. So we put the 2 links into the chat as well, so you have that information. But thank you all again to our panel. It is amazing to hear what these 3 communities are doing in order to support employee mental health and behavioral health, and really hope that you learned something here today that you're able to take back into your own agency, and even if you're from these communities, hopefully now you learned more about these programs that you have at your fingertips. I just want to give a plug for Arizona Women Leading Government. We just recently announced the save the date for our annual conference. It is going to be in November 7th and 8th in the city of Phoenix. We're going back to the Phoenix Convention Center, so please save those dates. Registration will come out soon over the summer. And we're going to be, hopefully having more of these really robust topical conversations in order to bring, more awareness and familiarity and destigmatize things like topics such as mental health awareness. Please make sure to renew your Arizona Women Leading Government membership if you haven't already. That will get you on our email list. We have another email blast going out in June with lots of great content. So, and then we will also be continuing to follow up with our webinars, hopefully another one coming soon in August, as well as some networking events. So thank you all again to our panelists. Hope you have a great rest of your Wednesday, and see you next time.
Thank you.
Thank you.
Bye.